Joining me on the hotline as we do each and every week is Dr. Dan Zanotti from the Center for Orthopedics with an injury update. I want to ask you today about a big devastating injury to a Cavaliers player. Ricky Rubio goes down recently with an ACL tear. And obviously it's a big loss for the team. Let's talk about ACLs for a little bit here. What does it mean when you hear the ACL tear? And does it mean the same as it used to? Like, it used to be the stigma where if you tore your ACL, like your career was over and all this stuff. It's changed, right, doctor?
Yeah, it has changed a lot. It's still a devastating injury in the sense that he's going to be out for some time, at least 6 months, sometimes even up to a year in terms of the rehab process. So it's a big injury, but it's still a fairly recoverable injury. And once he gets fixed in rehab, we're hoping he can get back to the level that he was playing at, which was fantastic.
We did a little research. This is the second time he's torn that left ACL. He did it his rookie season with Minnesota after colliding with Lakers' Kobe Bryant. In terms of injuring it for a second time, how concerned would you be?
Yeah, it is a bigger deal. Obviously, there's more structures than just the ACL in the knee, and anytime you tear one thing, you're more prone to tear another. So we always worry about cartilage injuries and other ligaments and associated injuries in the knee if you keep having recurrent injuries. So it is a concern that's going to need to be evaluated very closely, obviously with MRIs and other diagnostic tools, and then surgically when he has it fixed, they're going to have to look at what other structures need to be repaired as well.
In terms of the surgery, how do you fix it?
Typically, we use a graft from your own body, especially in an athlete like him, and we're able to reconstruct that ACL very well. And the results are quite encouraging and good. We've gotten a lot better over the years at fixing these. It's certainly not 100%. Not every athlete gets back to the level of participation after an ACL surgery, but we're hopeful with these newer techniques and endeavors that we can go down that we'll be able to get him back to that level.
Great insight as always. There he is, Dr. Dan Zanotti from the Center for Orthopedics. If you guys have questions or concerns, give him a call at 440-329-2800.